Hi, welcome to Steps to Strides with me, Connor Ratcliffe. We're back in the garage gym today, looking at some potential exercises for balance and proprioception. Today's exercise is a single limb stance exercise, and we're going to look at a regression and some progressions for that. Now, single limb stance is helpfully named. It kind of does what it says on the tin, but it's essentially a fancier way of saying standing on one foot. Now, whilst that might be easy for some, which is why we've got progressions, actually for others that's going to be quite challenging, and where they're unable to perform this, well, then that's probably not going to fall within a therapeutic aim, and we need to come up with a different strategy to target balance and proprioception for those patients. So what we'll look at is the regression first for that, and then we'll work through our progressions. And typically from an assessment perspective, this is where I'll start to see how well or not they can do that. A couple of things to consider really. When we're doing this, it's worthwhile just looking at seeing what the digits are doing. So extensor stabilization, flexor stabilization are quite common compensations that we might see, and they're not inherently bad, but depending on what we're trying to treat, then they might cause more issues than we actually resolve. So, you know, they're useful, they're advantageous. That's why we do it in an unstable position. They help us to stabilize. But the side effect to this is that we get gripping, we get hammering, we get clawing, where you might see a lot of extensor hypertone. The extensor's popping out the top of the foot. Now, as I say, that doesn't have to be an issue, doesn't have to be a problem, but let's say you have a plantar plate problem, then actually that could make those symptoms worse. So it just reinforces the fact that we need to know what's going on, we need to understand what we're prescribing these for in terms of the pathology to make sure that we're not going to make symptoms worse. So in these specific cases, I'll get people to do single limb stance, but the cue is relax toes, relax toes, relax toes. Now that actually makes this really quite a lot more challenging for people who have extensor or flexor stabilization. And that's again where this regression comes in and can be quite useful. So if people are really struggling with the base single limb stance, then I'll regress this back, or if I need to get them to relax toes, typically I'll regress this back into sometimes just hanging onto the wall, but in a single limb stance position to get them used to this position. Then the progression becomes wall taps, and we're taking away the hand for increasing amounts of time, and that becomes our progression, time between taps, until we can perform this completely freestanding. When this then becomes too easy and there's very little or very mild adjustment, well then we can look at our progressions. Now, without moving on to a different exercise and looking at more dynamic movements, which we'll look at in other videos, what we can do is mess around with things that contribute to balance, which biases towards proprioception. So we can take out the vestibular system and we can take out the visual system, which just leaves us with the proprioceptive system. And that's the sense of where we are essentially in time and space, and external stimulus giving us afferent feedback for efferent response. So that's the fancy sciencey bit of it, I guess. So let's look at a couple of those progressions. So if we want to disrupt the vestibular system, then we can look at head tilts. Then the cue will be to tilt our chin all the way back up to the ceiling and then down to chest. So up and down. And we're just cycling through that head tilt. And I can feel that makes me wobble a little bit more and challenges my proprioceptive system a bit more. Now, If we want to take the visual system out, that's a nice easy cue. We just ask patient to shut their eyes. Now typically this is actually quite a big jump and makes the exercise quite a lot more challenging. But let's have a go. And again, I can feel that I'm having to adjust and work a little bit harder there in that eyes shut position. Now, if I wanted to disrupt visual and vestibular, we can add our cues together, and we're going to add a head tilt to our eyes shut position. Ooh, and that's about the limit of my proprioceptive stability. So you can see that we've got some nice inbuilt regressions and progressions with just a really simple single limb stance exercise. And as always, it has to be pitched at an appropriate level, and that comes down to appropriate assessment of our patients to make sure it's within a therapeutic range. So that's today's exercise. That's single limb stance with regressions and progression.